will share. So we're about to have an introduction to this topic, which is kind of like trying to address two aspects of the cervix uteri. So we're looking at the benign lesions of the cervix uteri. Then also we're looking at the pre-invasive lesions. Do you understand? So we have benign lesions that they shouldn't actually lead to anything. You get it? They shouldn't lead to any cancer. They have pre-invasive, which is now going towards cervix cancer. Okay. All right. So moving to it, if we understand the cervical lesions, to help us to be able to dictate them very early, and of course, if you dictate something early, you initiate treatment, all right, to help you tackle the cervical disease. So for the benign lesions, right. So for the benign ones, we'll say something is benign. That thing is friendly. It's just in one place. That thing will not cause issues to you. It's not life-threatening. Do you understand? So benign lesions itself is not a disease condition. It's a way of classifying things. Understand? So for benign lesions, we have things like cervicitis. We have Nabothian cysts. Okay, cervicitis just simply means the cervix is inflamed. As simple as that. Okay, then we have cervical polyps, which is here. All right, then we have squamous metaplasias. That one is when the epithelium is being replaced. Then granulomatous lesions, where you can have tuberculosis spreading to the cervix, or sarcoidosis. Okay. So symptoms, if all these issues are inside the cervix and all of that, most of the times you have the woman having vaginal discharge, post-coital bleeding, so she has sex. After the sex, there's a whole lot of bleeding, menstrual irregularities, pelvic discomfort. So of course, if I want to confirm the disease condition, I'll do pelvic examination, I'll do pap smears, colposcopy, biopsy. All right. Then for the pre-invasive lesions, when we say something is pre-invasive, it's almost becoming a cancer. It has a potential to progress to cancer if you don't treat it. Do you understand? So for the key types, we have what? The cervical intraepithelial neoplasia. That's the main type if you are talking about pre-invasive lesions of the cervix. So we have the type 1, which is mild. We have the type 2, which is moderate. Dysplasia means the cells, the arrangement of the cell is being scattered. But this one, don't worry, we'll talk about this in a special lecture. We have the type 3, which is very, very severe. Okay. Then that's all. This one is under cervical intraepithelial neoplasia. All right. Another different type is what? Atypical squamous cells. We have human papilloma virus related changes. Okay. So those ones, to diagnosis, same thing. Pap smears, you just want to pick up if the issue is being caused by human papilloma virus. Then HPV DNA testing. I think that one you want to be very, very sure. Okay. Then colposcopy with biopsy. So management, you can just observe for low grade lesions. Then cryotherapy or laser ablation. Then loop electrosurgical excision procedure. Then cone biopsies. Okay. So that's the various ways that we actually tackle these issues. All right, so this is just an overview lecture. We'll have in-depth lectures on each one of them. You get to understand it better.